Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about the different ways essentially to determine how to treat SI joint pain. But before I begin, please hit that subscribe button below. So essentially the SI joint, this is an area between the pelvis and the sacrum, which is the lower portion of the back. And it typically can become painful for two very distinct reasons. One is too much mobility in through the area, and the second is if there's not enough. So essentially the SI joints, just like any other joint, shoulder, knee, you can get a degree of movement in through that particular area. And so in some cases, the SI joint, which typically will present as very localized pain, right in the area between the sacrum and the pelvis, there won't be any numbness or tingling, so it won't be like a sciatica. It'll be, again, very localized, not a lot of referred pain typically with this. Sometimes you might get a little slight referral down through into the buttock area, but again, it tends to be, you can kind of push on the area and the patient will say, yep, that's the spot. It's very, very localized. And so as I mentioned, there's typically two reasons that this will be painful. One is it's more or less stuck, or it's rigid, or the pelvis and the sacrum are just not moving in a fluid fashion. The other is that there's actually too much mobility, and in that case typically there's a lack of strength in some of the pelvic stabilizer muscles. So this would include, for example, your pelvic floor, transverse abdominis. This might include your glute muscles. So these would be particular areas of the body that these muscles, their job essentially is to stabilize that area. And so once we've determined that that's the area involved, right, then we want to do specific tests to see, okay, is this pain a result of too much or too little, again, mobility. One thing I like to do with patients with regards to that, again, once I've determined, okay, I'm fairly confident the SI joint's involved, what I might have the patient do then is some form of either an active straight leg raise or something that requires some form of stability, right? So in a lot of cases, if the patient, for example, gets pain when they're doing this active straight leg raise, which requires pelvic stability, I can somewhat assume, okay, I'm thinking then that this pain might be a result of a lack of strength in the muscles that help to stabilize the pelvis. And so one of the tests I would then do is to compress the pelvis in some way. So I might do this manually, compress the pelvis together, or I might even just have the patient wear a belt, just short term. So basically use maybe even a yoga belt, and just have the patient then redo the active straight leg raise or something that requires some form of stability. And if their pain goes, essentially if they're pain free, then I can sort of determine in a lot of cases that, okay, it looks like in this case that there's weaknesses in through this area. And then what I'd want to work on initially is to give the patient some specific exercises, right, to work on strengthening and increasing stability through there, and ideally make that more functional. From a short-term perspective, that patient might also benefit by using an actual SI joint belt to help with that pain. So you see this again in a lot of individuals who they might be doing a job that requires a lot of repetitive action, and again, they just don't have the core strength. Or you'll see this in women who are pregnant, for example, where, again, because of hormonal changes, there's an increase in the amount of movement through the pelvis. And so in those cases, temporarily speaking, a belt might be beneficial as we work on strengthening those different pelvic muscles and then weaning the patient off of the belt. Because unfortunately what ends up happening, although the belt will be good short term, it's basically doing the job of these muscles from a long-term perspective. So eventually we'd want to wean the person off of the belt. So that's what you would essentially do with somebody who's presenting as an instability in the pelvis. Now, if, for example, they're in pain, but increasing stability does not reduce their pain, then typically we're thinking, okay, there's a lack of mobility through the SI joint, and what we're looking to achieve is to actually increase mobility through there, and then there would be specific exercises that can help in terms of improving, right, the movement between the sacrum and the pelvis. And again, we'd be looking from more of a mobility standpoint in terms of how to treat that. If you have any specific questions or concerns, feel free to leave a comment below, and have a great day.